Basavatarakam Indo-American Cancer Hospital and Research Institute presents a film on cervical cancer awareness. The film is sponsored by Andhra Bank in the service of society.
The word cancer means a crab, which reflects the true character of cancer since it sticks to the part stubbornly like a crab. It is a malignant tumor, that is, a mass of tissue formed as a result of abnormal and purposeless multiplication of cells. But all tumors are not malignant. Many tumors can be benign. Every year, about 120 lakh people are diagnosed with cancer in the world. And 76 lakh people per year die with cancer all over the world. In India, 25 lakh cancer cases are present at any given point of time. But the fact is, cancer, like any other disease, is curable if detected early. The common types of cancer are cervical cancer, breast cancer, oral mouth cancer, throat cancer, lung cancer, ovarian cancer, prostate cancer, stomach cancer, blood cancer, and colorectal cancer. Cervical cancer is the most common genital cancer found among women in India. The lower part of the uterus or womb is identified as cervix. Cervical cancer originates from the lining of the cervix. This is a very slow process and often takes years. That is why identifying it early can be life-saving. Nearly 1 in 4 cases of cervical cancer around the globe occurs in India. It peaks between the ages of 35 to 50 and not only takes the lives of young women but also devastates their families along the way. Risk factors for cervical cancer. One of the common causes of cervical cancer is infection with human papilloma virus, that is HPV. The virus is sexually transmitted and triggers abnormal growth of the cells in the cervix leading to cancer. Poor personal hygiene, multiple sexual partners, multiple pregnancies, especially with poor spacing between each pregnancy, first pregnancy before 20 years of age. Women with sexually transmitted diseases like HIV, herpes simplex 2, human papilloma virus are more at risk. Immunosuppressed individuals, poor socioeconomic status, unable to afford regular screening, smoking, drugs, alcohol, sexual intercourse before 18 years. Despite this, there's a good news. Cervical cancer is preventable and can be totally curable if detected in precancerous and early stages. Regular screening tests can detect precancerous changes in the cervix up to 10 years before invasive cancer, and treatment can be initiated before it progresses. Cervical cancers are broadly of 2 types: squamous cell cancer and adenocarcinoma cell cancer. Squamous cell cancer is the most commonly found type in women. More than 80 to 85% women diagnosed with cervical cancer suffer from squamous cell cancer. Majority of cases are asymptomatic, which means until they progress to advanced cancer, no symptoms are visible. The most common cervical cancer symptoms are continuous vaginal discharge, can be pale, watery, pink, brown, bloody, foul-smelling. Spotting or bleeding from vagina after intercourse, in between periods, and heavy or prolonged menstrual bleeding. Pain while urinating, bleeding after menopause, Symptoms of advanced cervical cancer may include back pain, pelvic pain, leaking of urine or feces from vagina, fatigue and weight loss, heavy bleeding from the vagina, leg pain, single swollen leg, bone fractures. Diagnosis of cervical cancer. Cervical cancer can be detected by Pap test, colposcopy, biopsy, and endocervical curettage. Pap test is the most common test for early detection of cervical cancer, where cells from the cervix area are examined. The Pap test can tell if the woman is healthy, has an infection, abnormal unhealthy cervical cells, or cervical cancer itself. It is a simple and quick test. While the woman lies on the examination table, the doctor puts an instrument called speculum into the vagina, opening it to see the cervix. A special brush is used to take a few cells from inside and around the cervix. The cells are placed on a glass slide and sent to a lab for examination. Pap test is a painless OPD procedure which can be easily performed in a screening camp, even in the rural areas, by a doctor or a trained health worker or nurse. However, the test report is given by a pathologist. There are many reasons for abnormal Pap test results, but it does not mean that one has cancer. If the doctor suspects precancerous changes, or if the test shows serious changes in the cells of the cervix, the tests the doctor will suggest are colposcopy, biopsy, and endocervical curettage. Colposcopy. Colposcope is a device used to study cytological detail of the cervical and vaginal epithelia at a magnification intermediate between the naked eye and lower power of the microscope. The cervix is exposed by the appropriate sized self-retaining vaginal speculum. The colposcope is positioned to illuminate the cervix vagina. The cervix is stained with acetic acid, and the doctor removes a small sample of cervical tissue. This is done in OPD without anesthesia. The biopsy sample is sent to the lab to be studied under microscope. Endocervical curettage. The doctor takes a sample of cells from the endocervical canal with a small spoon-shaped tool called a curette. The sample is sent to the lab. It is useful in doubtful clinical examination or negative Pap smear report. A Pap test can save the woman's life. It can find the earliest signs of cervical cancer. When found in the early stages, there are many treatment options that often provide complete cure. Undetected precancerous changes can develop into cervical cancer and spread to the bladder, intestines, lungs, and liver. It can take years for precancerous changes to turn into cervical cancer. Patients with cervical cancer do not usually have problems until the cancer is advanced and has spread, at which point there are very few options left for treatment. Getting regular Pap tests is the best way for early detection of cervical cancer. In fact, regular Pap tests have led to a major decline in the number of cervical cancer cases and deaths in developed countries. It is important for all women to have Pap tests along with pelvic examinations as part of their routine healthcare every year. Women who have gone through menopause still need regular Pap tests. Pap tests should be carried out every year for all married women. Women who are living with HIV, the virus that causes AIDS, are at a higher risk of cervical cancer and other cervical diseases. All HIV-positive women should get an initial Pap test and get retested 6 months later. Many things can cause wrong test results by washing away or hiding abnormal cells of the cervix. So, doctors suggest that for 2 days before the test, one should avoid douching, using tampons, using vaginal creams, suppositories and medicines, using vaginal deodorant sprays or powders, having sex. The best time to be tested is 10 to 20 days after the first day of your last period. Treatment for cervical cancer depends on the stage of the cancer, the size and shape of the tumor, the woman's age and general health, and her desire to have children in the future. Once it is diagnosed as cancer, the patient should seek the help of an oncologist, a doctor who is specially trained in treating cancer. He will decide whether the patient needs surgery, radiation, chemotherapy, or a combination of them. Early cervical cancer can be cured by removing or destroying the precancerous or cancerous tissue. There are various surgical ways to do this without removing the uterus or damaging the cervix, so that a woman can still have children in the future. In some cases, a hysterectomy or removal of the uterus may be advised. Chemotherapy and radiation are other treatments for cervical cancer. Prevention of cervical cancer. Cervical cancer is a serious disease, and hence, prevention is extremely important. The most important step in prevention of cervical cancer is the creation of awareness among the women, especially among those living in poor localities. Improving personal hygiene, practicing safe sex using condoms also reduces the risk of HPV and other sexually transmitted diseases. HPV infection causes genital warts. These may be barely visible or several inches wide. If a woman sees warts on her partner's genitals, she should avoid intercourse with that person. See your doctor immediately if you recognize any of the symptoms that lead to cervical cancer. A vaccine to prevent cervical cancer is now available. It is ideal to give the vaccination before the girls attain puberty, or at least before young women start their married life. This prevents infection against the 2 types of HPV responsible for most cervical cancer cases. To further reduce the risk of cervical cancer, women should limit their number of sexual partners and avoid partners who participate in high-risk sexual activities. The most important step to bring down the incidence and deaths due to cervical cancer is regular screening, which helps in early detection and prompt treatment. A healthy lifestyle and balanced diet with reduced stress are also key factors that prevent cervical cancer.